everyone. Welcome. Thank you for joining us this afternoon for this special Treat Me Right live from WomenHeart. Today, we are joined by an incredible WomenHeart champion, Gwen, who brings a really powerful story and a very unique advocacy perspective to this conversation. Gwen is a former physician's assistant, attorney, and longtime health policy expert who now channels her expertise into improving the patient experience. She was diagnosed with hypertrophic cardiomyopathy, and Gwen knows firsthand how important it is for women to be informed, empowered, and treated right. So today, Gwen is here to talk about how we can how all of us can take action, whether it's in the doctor's office, in policy, in the community, in your day-to-day conversations with others, and to really just ensure that women are getting the right diagnosis and treatment at the right time. So thank you so much for being here today, Gwen.
Thanks, Sarah. I'm delighted to be here. Really looking forward to the conversation.
Well, let's get into it. Let's get into the questions. Could you please briefly introduce yourself and share a little bit of your heart journey with us?
Absolutely. So I think you hit some of the highlights, but just to reiterate, I have hypertrophic cardiomyopathy, so that can be a real mouthful. That is a genetic, in my case, a genetic mutation. So I was born with this condition. I was diagnosed many, many years ago. We're going to even put that into decades now. But this is a lifelong condition. And sadly, even though it isn't always a risk factor anymore, it's often associated with sudden cardiac arrest. So a lot of people maybe know about somebody in high school or college or an athlete who died suddenly from cardiac arrest. And that is true. It is a side effect of hypertrophic cardiomyopathy. But it is a way to define the condition. It's really a thickening of the left ventricle or your main pumping chamber in your heart. And that creates a lot of tendencies to have irregular heartbeats, shortness of breath, palpitations, fainting, etc. So it is a muscular sort of deformity. And it is quite prevalent, actually. It's about 1 in 250 are considered to have some form. But as a spectrum, there are those who have mild cases. Mine is relatively moderate, and then plenty of individuals with more severe cases, maybe some even needing a heart transplant. Other than that, as you mentioned, I've had a big career in health policy, which has kind of tracked along my health condition as well, mostly in Washington, D.C. I'm now semi-retired and doing my part to work with patients to share their stories.
Thank you. Thank you for sharing. And so since you've mentioned all of the policy work you've done in the past, I know that you've been involved in a lot of different organizations. What inspired you to get involved with this Treat Me Right campaign?
Well, this really speaks to me for a couple of reasons. I'm sort of on my own personal campaign these days to help elevate and any example and opportunity I have to elevate the patient's real world experience into the healthcare decision making. I mean, when I was diagnosed and many years ago, when I was younger, it was a very paternalistic doctor's knows best, but those days are behind us. Patients now are becoming their own best advocates. They're learning about their health conditions. They're speaking up, they're asking questions. And so we all want to be treated right, and patients are getting more engaged in that. So I'm sort of part of that campaign now to help just raise awareness. Also to make sure that an issue that's become very increasingly important to me is how chronic illness, or in our case today, talking about women's heart health, how also that impacts our mental health. And so any opportunity that I get, I also want to remind clinicians, providers, patients, individuals listening, that your mental health and having a balanced mental health is really important to you as you go about caring for your heart health. And they basically go hand in hand. So I look for opportunities to do that. And I felt Treat Me Right was a good one to do that.
Yeah. And so through this journey of your care, whether it was in the past, now, really throughout this long journey, when was really the moment where you realized that your voice needed to be heard more clearly?
Well, in that case, Sarah, I'm having someone who's had symptoms pretty much my whole life, even a murmur at birth, and then having fainting and challenges when I was a teen. But I was very, very active. So I wasn't diagnosed until my 20s and 30s. But the concept of patients and patient advocacy really wasn't known at the time. There was not a lot known about this condition. And matter of fact, it had a completely different name at the time. It was considered a terminal illness. The first thing a cardiologist said to me is, you'll have a shortened life expectancy. So I've had to actually learn very early in my life that if I didn't sort of do my part to keep up with the health conditions and to read the literature, or to just research or ask experts to get involved, then I was going to get left behind. And so part of what I learned in that is that it also meant that I had a lifelong health condition, that I was not going to outgrow a genetic mutation. And I knew enough medicine as a former physician assistant to know that there would be other advancements. And I wanted to be part of that. But a lot of it just had to do with the fact, quite frankly, is that I found there were just very few health providers who actually knew what hypertrophic cardiomyopathy was. So I'd find myself in the back of an ambulance with a heart rate of 180 and everybody thinking I'm having a heart attack or a stroke, when in fact I was not. I was either having a miscalculated counting of my heart rate, or I would say, well, no, I have hypertrophic cardiomyopathy, and I would get blank stares. So those days are behind me. But again, it really taught me early on that I have to do my part. And so I started taking notes. I started asking hard questions. I started getting copies of my medical records, and I would just file them, quite honestly, for many years in a Plano 69-cent composition notebook that you could buy at the drugstore. And I would go in and I'd start writing down everything this doctor said. I also learned very quickly that enabled me, the next time I saw him or her, I didn't have to go over it. It was like, last time we talked, okay, here's where we were. So it was really that practice that has continued over the years. And just this week, I saw two of my clinicians, two of my doctors, and I take notebooks now in every time. I ask to write down my important lab work. I have my questions prepared, but it's really been a journey realizing that, I had to do my part when I showed up in the doctor's office. And that's how I became, I think, probably a really staunch advocate for my care.
Yeah, I mean, that's really excellent advice, to take your own notes, to come prepared with your own questions. Also, central to this campaign as well, since some of the tools that we want to offer and empower women to use are bringing their own questions, speaking up at the doctor's office. And so, given your more scientific background and the professional sense, and then also in your personal journey, like you were mentioning with your research about your condition, what does evidence-based care mean to you as a patient?
Well, evidence-based care to me means, I think it's kind of changed over time. Again, I think we're moving more into a time where the patient's lived experience and real world experience is being more valued, as maybe not being equally as important as a clinical trial data or research, but certainly ranking up there pretty high, particularly, again, if you have a long-term cardiac or any long-term chronic condition. Your trends, your knowledge of your body, your experience, your ups and downs are going to be very, very important. So evidence-based medicine to me means, again, the right clinical expertise. So what does my clinician, nurse practitioner, therapist, rehab expert, going to the best care that I can through my plan, or I can travel to, or I can afford to, what is their specialty? I do need a lot of specialty care. Not everyone does, but I need specialists who are trained specifically in my heart condition. So it's their clinical expertise, but they're basing that upon hard science. They're basing that upon scientific literature. They're basing it upon clinical research. They keep current in their profession. They understand their guidelines, where the American Heart Association, American College of Cardiology in our case, they understand, and they are current on that. And so I would sort of say the third leg of that three-legged stool now, I would say, is what am I experiencing? And again, that gets back to me note-taking, staying current, being diligent about, taking my own blood pressure, taking my own heart rate, my weight, all of that. I manage with my own devices every day, but doing my part. And so I think we need evidence-based care, takes each of those into consideration.
And do you feel like a patient has a right to come to their doctor and ask, hey, am I being treated according to the guidelines for my condition or for women my age?
Absolutely. Absolutely. Which reminds me of a little bit of a funny story because, again, many years ago, but I'm going to sort of date this as being maybe, let's going to say 25 years ago, it was about the year 2000. I was living in Louisville, Kentucky, my home state of Kentucky. My mother had recently passed, and I was back there, and I was out of my routine care, which I had received in Washington, D.C. But I began it was sort of the advent of the internet. And there was sort of this, I'm kind of a research nerd anyway. And so I was trying to keep current, what's going on with different drugs and devices, et cetera. And all of a sudden, I don't even remember now, but here comes the guidelines for hypertrophic cardiomyopathy that were published by the American College of Cardiology and American Heart Association. They do that not just for my condition, but the guidelines are out there. So I printed them out and I took them into my next cardiology appointment with my cardiologist, and he was floored. He's like, how did you get these? I haven't even heard about this. I haven't even read them. And I had gone through and I had highlighted. So you better believe that if you get me for a patient, you got to be on your P's and Q's, because I had highlighted and written my questions in the margin, and he was very informed, and we laughed about that on many occasions. So absolutely, any and everything that most of the points a lot of clinicians are reading, certainly when it comes to published guidelines, all of that information is available. If you don't understand it, use some of the newer techniques to understand and put it in language that you do understand it. But you're certainly within your right as a patient to come prepared with questions.
Thank you for that excellent example, Gwen. I think sometimes there's a misconception that coming with those types of questions or coming with that type of information is creating a conflict type of or an aggressive environment with your care provider. And that's not the case at all. The goal is to create really a team that's supporting around you, with you, shared decision making. And it's lovely that you guys laugh about it later and are able to share that experience over the years.
Right. And I was just going to add to that, I try to also remember that everybody in the room, so I've had 20 different cardiologists throughout my life. And a lot of them are specialists. A lot of them are general cardiologists, electrophysiologists, thoracic surgeons, heart failure cardiologists, et cetera, geneticists, et cetera. But I always try to go in realizing that everybody there wants the best outcome for me. And yes, egos can get in the way. And yes, every doctor is not the same age or trained the same way. And not everybody who feels swamped because they've got a busy practice and you've had to wait 4 months for an appointment is going to have the same courtesy or the same time. And you have to just understand that and be a little bit flexible with it. And again, I go back to it. The best I can do is be prepared myself and come with an open heart and an open mind, that they're there to do the very best they can, and that my questions can be framed in a way that will help them help me, which is what I need them to do.
Thank you. Thank you for that. And I want to shift our conversation a little bit to your experience as a WomenHeart Champion. And so what initially encouraged you to take the leap into becoming a champion?
Well, it was 20 years ago. So the organization was 4 or 5 years old. Working in Washington, I had the good fortune of knowing a lot of different advocacy groups. I saw that more patient advocacy groups are being formed. But for me personally, I realized that I needed emotional support. That I felt that I had really a lot of opportunities intellectually and through my career, and lots of great opportunities in Washington, and jobs that I had to be around some of the brightest, and lots of conferences. And so I was really fortunate to be on the front row of a lot of cutting edge science, but I wasn't so good at keeping my own voice and my own head and my emotions in check at night. I was very worried about what people would think if they knew I had heart disease. I really struggled in relationships. I felt I was alone. There was hardly very much information known about hypertrophic cardiomyopathy. I kept saying people like, you don't look like a patient. You don't look sick. I felt like I was being dismissed. I felt like that my nervousness or my palpitations weren't being taken seriously. And that was mostly on me. And so I saw Women Heart as an opportunity to meet other women and go to the Scientific and Leadership Symposium. It was my first opportunity, and it really was life changing for me. And I've just enjoyed being part of it and doing everything I can to make sure that other women who maybe are coming behind me or younger women see the same opportunity at Women Heart that I have found.
It's so lovely to hear that. You're such a valuable addition to the Women Heart Champion community, and we're so glad to continue to have you engaged and active and sharing with other champions, younger champions, as you said. And could you tell us a little bit more about how Women Heart has supported you throughout this journey?
Sure. Well, I think that, again, as I mentioned, the Scientific and Leadership Symposium is really an anchor for me. How maybe it wasn't intentional, but I first went in 2005 at affiliated with Mayo Clinic, as most people know about Women Heart. And just having that opportunity was so eye-opening for me. And to meet the experts and to really know that you're going to be getting the best of the best. I mean, not everybody has a chance to go to Mayo Clinic. And that opportunity was really life-changing for me. And as a matter of fact, so life-changing that Mayo Clinic became my primary care provider in my cardiac space 4 years later. And so in 2009, I became a patient at Mayo Clinic, and I've been there every few years ever since. So that door was opened by Women Heart. And for me personally, I really enabled me to feel confident that I could approach many of the clinicians there. Subsequently to that, having over the years, I think on a more personal level, I have had several heart sisters. Regrettably, a few of them have passed away, but I've had heart sisters, and we have a pack that we can call each other 24/7, that there's no fear, there's no panic attack, there's no anxiety that is too small that we cannot pick up the phone and call one of each other in the middle of the night or the middle of the day. And boy, that got me through so many tough times in the emergency room when I really didn't feel that anybody else understood. And some of those women I have never met in person. And Women Heart has opened those lines of communication for me. And it's just incredibly resourceful. So I'm very grateful for that.
That's really special. I also want to circle back to some of the things we were talking about earlier in our conversation. So, knowing you mentioned it a little bit in terms of taking notes at your doctor's appointment, speaking up, and maybe bringing some guidelines along with you if you would like. But what tips would you offer to women who are struggling to speak up during their doctor's appointments?
Well, I would say do anything you can to prepare for that visit. So it may be that, if you want to talk it out with your spouse or an adult child or a friend, maybe there's somebody in Women Heart or a heart system, just talk it out, just so you hear yourself saying the words. I think thinking through what is the priority for this particular visit. Is it a routine visit? Is it a new symptom? And how do you describe that symptom in a way that your clinician, who is always going to look at you like, get on with it, okay? It often happens. How can you succinctly talk about that and how it's changed? Okay. It takes you 5 minutes to get dressed in the morning or put on your shoes. Can you only now walk, to the grocery, and then you have to sit down and you're short of breath? So be prepared to succinctly talk about what has changed, if it's an update, etc. I feel like that anything you can do to also understand that the individuals that are there to serve you. They may not be having the best day. They may be lines of patients. You may have waited. I waited one time in a room with no windows and only a door and a desk for 3 hours. 3 hours.
Oh
For
my
a
God.
surgeon to get out of surgery. He was coming to see me, and the thoracic surgeon had an emergency come up. Okay. Now, that was not his plan. All right. I don't need, that's not a good memory for me to have. But that wasn't also the goal I had of the day. The goal of the day is I needed to know about my surgery. And so those were 3 hours that I had to wait. And so a lot of times we expect there to be this immediate care. Our healthcare system is stressed to the max. Anybody goes to an ER knows that, et cetera, or waits in the pharmacy, et cetera. So I would just say, when you go to see your clinician, realize, don't always look for something to go wrong. Don't always count how many minutes you're waiting. If you've got the time to do that and you've got a good healthcare team, try to focus on what's going right, what you can do, how you can contribute to the conversation. Again, how can I make your job easy? How can I help you to help me? And that's a mindset that we have to get into, particularly if we have a chronic condition, over and over and over again. And I think that with some time, it gets easier. And I've even said to my doctors, what can I tell you that will help you do your job? What can I tell you about what's happened in the last 6 years? What do you need to know that will help you do your job? And they'll
That's so
tell you.
important. Contributing to the conversation is really an excellent way to put it,
Right.
because it is shared decision making. And also,
Right.
back to Treat Me Right, that's a lot of what we talk about is what
Right.
questions. Could you tell us more about different questions you ask the doctor when you go?
Well, again, I think a lot of it depends upon the purpose of your visit. If it's a routine visit, okay, well, it's routine. I focus on trends.
Okay.
Okay, so if it's a routine visit, then I know it's going to be every 6 months or every year. And I have my own little spreadsheet now, and I have my little notebook, and I have my own little charts. I just make them myself. And so I try to have that in front of the doctor. I don't my chart or whatever. I just are like, okay, see, when I did this last time, my heart rate went up 10 beats a minute for the last 6 weeks, So I don't just rely upon the snapshot when I've been huffing and puffing to, catch the bus or the train or get to the parking lot in the middle of the rain, because my blood pressure is going to be high, right? So I try to add to, so if it's a routine visit, I would say, let's talk about the trends, my blood sugar, A1C, weight, what am I trending? If it's something that's new or different, like a new medication, I always ask things like, how will I know this medication is working?
Okay.
So my heart, am I going to have less pain, chest pain? Am I going to have less palpitations? Do you think I'm going to sleep better? Am I going to gain weight? How will I know if this drug is working? How long should I wait before I get back to you if I don't feel it's working? What kind of side effects could I have? And a big one these days is when I'm, in my health or any person I partner with, what when do I need to go to the emergency room?
Mhm.
Because when you have a heart condition and you're in atrial fibrillation or ventricular fibrillation, or no, you're not, that's not, or like a PVC, or you're having chest pain, heart patients are mulling this over in their minds like, oh, it'll pass. No, I need to go to sleep. No, it's just anxiety. They're ruminating about this over and over. So I specifically always ask, even to these days, particularly if I have a new drug or if I had a new procedure, when should I go to the emergency room? And they'll tell you, when this happens, that happens. When should I take more medication? If your heart rate's over 100, I want you to take more. So I try to anticipate, again, by asking very specific questions if I've had a change in care. I always try to remember and always ask something like, what have we not talked about that we should have? What am I? And I kind of get, because I got my notes and I go, let me check. Ding, 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 ding. And some of them are just a check. Yep. Yep. No, I'm still not losing weight. Yep. No, I'm not exercising. Yep. Okay. Okay. But what haven't we talked about that we should have? What do I need to know? What can I tell you? And that's really, and when will I see you again? And what's the easiest way to reach you?
I really like that emergency room question. I think it's helpful. It kind of builds your own self empowerment to not doubt your symptoms or not have those questions of, am I just anxious? Is this worth it? Especially since cost also often becomes a factor. Am I going to spend $300 down the drain because I went to the emergency room and it ended up not being necessary? Or is it worth
Right.
it? That's very important.
Right. Right. And a lot of the surprise medical billing we hear about, or people will wait till their symptoms and then they have to call an ambulance, right? And then maybe they're a little bit behind the 8 ball by the time they get there. Yeah. So.
And so our conversation is wrapping up, and I really just wanted to hear from you. What are key messages do you feel like the women watching today should walk away with?
Well, I think the key messages for Treat Me Right is to realize that, you're a partner in your own care. This is definitely affects, particularly heart disease, is going to affect every aspect of your life, your emotional well-being, your mental health, your relationships with your partner, spouse, loved one, your children, whether you can work, if you're in rehab, how it affects your sleeping patterns. It's going to affect everything in your life. So Treat Me Right is really just a sort of something to kind of keep in the back of your head, is that what do I need for them to treat me right? Do I need to do my part and learn a little bit more about this drug, or a little bit more about this hospital or doctor or condition? Do I need to kind of brush up on my homework? What does it mean for me to be treated right? What is realistic about that? And so I think that we have to, particularly in our case as women living with heart disease, is to really be a partner in our care. Not only are we advocating for our care, but we have to be a partner who does their own part in maximizing and optimizing their clinical experience. And along with that is to recognize that it's going to feel uncomfortable and awkward asking questions. You're not pushing back. And if you feel like you are, just say that, or just say, I don't know how to ask this. I don't want you to take this the wrong way. I'm not really sure how to say this. Just spill it out, or maybe try to pick somebody in the care team, maybe a nurse practitioner or a therapist that can help you before you go in there. Practice saying what's on your mind. And those would be some things that I think that I would hope that women and those others listening today really take away.
And if someone wanted to get involved further in this Treat Me Right campaign, what should they do?
Well, first of all, come on, welcome, join the crowd, get on board. Heart disease is the leading cause of death among women. It comes in many, many shapes and forms, and we need women of all ages and stages of life, and with lots of different conditions. everything from hyperlipidemia to chronic illnesses to heart failure to transplants. So heart disease touches a lot of different conditions across the lifespan. And so we need as many voices as possible. I'm sure more information on Women Heart on the website and any of the social media campaigns that Treat Me Right is involved in. You'll see those more and more out there in your social media packets and visuals.
Man, thank you so much, Gwen, for sharing your stories with us today and your advocacy efforts. We really appreciate you sharing all of your experience, your tips, your tools. Thank you so much.
Thank you, Sarah. It was my pleasure and honor to be part of the program.
Well, if you are watching and you have ever felt dismissed or misunderstood in your healthcare journey, please know that you're not alone and you deserve better. WomenHeart's Treat Me Right campaign is working to make sure that every woman, especially those who are often overlooked, gets evidence-based, guideline-driven care that listens to her voice. Just like we were speaking with Gwen about how she speaks up and uses her voice, you deserve the exact same. And so we really hope that you will join this movement and demand better care for all women. And we'll see you next time. Thanks, everyone.
Thanks.